Let's be honest, modern medicine is broken. Patients are dismissed, doctors are exhausted, and mental health care is decades behind. So it's time to disrupt the status quo, to challenge a system that fragments care, dehumanizes patients, and burns out clinicians. I'm Dr. Georgine Nanos, and this is The Kind Revolution, a podcast about breaking old paradigms, rebuilding medicine with compassion and science, and reimagining what healthcare can be when we finally get it right. Because change is here, and it's starting with us. Welcome to the revolution. Welcome back to The Kind Revolution, where we talk about medicine, innovation, and the deep layers of health that help people feel confident, empowered, and truly well. Today's episode is such an important one, especially as aesthetics becomes more mainstream and more accessible than ever. I'm joined today by my dear friend, Dani Kobus, family nurse practitioner. Dani earned her Bachelor's of Science in Nursing from the University of Massachusetts Amherst and her Master's of Science in Nursing and FNP degree from the University of Southern California. She brings us 17 years of nursing 17 years of nursing experience, 11 years in the ICU, and 10 years working along world-renowned plastic surgeons in San Diego. And she also used to work in my office at Kind Health Group, developing deep expertise in facial anatomy and aesthetic medicine. Inspired by the joy and confidence patients felt after treatment, Dani began injecting in 2020 and now specializes in regenerative medicine and natural-looking results that leave patients feeling refreshed, never overdone. And she believes aging is a privilege and one we can embrace more gracefully with the right care. Today, we're diving into the safety of injections, how to choose the right injector, why experience and expertise matter, and why you pay more for them. This is an important one. And the myth that injecting is just placement, and how functional medicine and regenerative aesthetics intersect. Dani, welcome to The Kind Revolution. I am so excited to have you with us today.
I'm so happy to be here. Thank you so much.
Let's talk about your journey from ICU to aesthetics. And, you have such a strong clinical background, 11 years in the ICU and a decade working in plastics. How did that shape the way you approach aesthetics today and your ICU level of critical thinking, how it's translated into your injection safety?
I always am a challenger of myself. So right out of nursing school, I was like, I want to do the hardest thing, and that was ICU. And I wanted something fun though too. So I got a job in the OR and plastic surgery, and that was like my easy fun job. And the ICU was like my medical brain job. So both of them shaped me into an aesthetic injector who puts medicine at the forefront and science at the forefront. My ICU experience is like just dealing with people, right? It's not just about the patient, but in the ICU, you deal with families, you get to know people in their inner workings and just really get to know them better. And for aesthetics, I think that that's so important. I think that people want a genuine connection. Is super personal what we're doing with these people. We're messing with their faces, and that is scary for a lot of people. So they need to know that like you're not just going to be a good injector, but you're going to be supportive, you're going to be honest, you're going to be genuine, and all of those things. So I think just all of my medical background has helped with that.
That is so beautifully put and so true and so desperately needed because, you and I both have seen so many patients that come to us after they've been to an experience that was not that, and what it can do for them, for their confidence and their results as well. So what did you learn? Let's talk more about, you've got really intense critical ICU level thinking skills. How does that translate into injection safety for you? Very unique to your background. Most injectors don't have this level of safety and clinical safety background that you do.
I mean, it's quite simple. Do I know what to do if somebody's allergic to lidocaine and they go into anaphylactic shock? Like, you have to have your basics first before injecting in medicine, because it does integrate in. I have had patients who have had, allergic reactions or a dermatitis. I recently had a patient who I did a VIP on, and she ended up getting a herpetic lesion from it. And if I didn't have my medical background and my nurse practitioner background too, I wouldn't have been able to diagnose that and take care of that treat her properly, which was sending her to primary care. But having that knowledge, aesthetics is just, it's way deeper than skin and injections. Like, we're turning on systems in the body that we need to be aware of, and we need to understand those systems.
Yeah, it's very true. So kind of diving a little further deeper into the safety and aesthetics. What does that truly
Hmm.
mean to you? What are patients not thinking about when they just, book a Botox or filler appointment?
Yeah, their past medical history is huge. What autoimmune disorders could be potential for my patients? Are they on a baby aspirin daily? Are they at increased risk for bleeding? Um, there's so many connective tissue disorders that we need to be aware of. Do they keloid? If I put Sculptra in my patient, is it going to cause nodules because they have a history of keloiding? There's just all these different angles that you need to be thinking about when you are putting safety first with your patients, and not to mention anatomy. I mean, it's not basic in the face. Our vessels are very torturous and they're all over the place, and we can cause real damage to people, including blindness. And it's something not to be taken lightly. It's not a frou-frou job. It needs to be, you know, taken heavily and understood heavily.
I think so many patients really, like you said, underestimate the complexity of our facial anatomy. It is one of the most complex areas in the body in terms of, like you said, vessels, nerves. And if you don't have a well trained injector who deeply understands facial anatomy, a lot of things can go wrong, right?
Yeah. I feel like people think of anatomy and they think like muscle, right? That's kind of the last thing that I'm thinking about, unless I'm doing like
Yeah,
neurotoxin. But when it comes to like Sculptra or filler, any of that, I'm not thinking about the muscle. I want to stay away from the muscle. I'm thinking about the different layers of our tissues, our epidermis, our dermis. You know, is aging coming from deep fat loss, superficial fat loss? I'm making sure that my product is not going in the muscle, because then it distorts your animation and that's where you look weird. Like, anatomy is so much more than just musculature and how it's moving.
yeah. And then, like you said, emergency preparedness and managing outcomes that are
Mhm.
not, that don't go as planned, because that's what happens a lot in medicine. Things don't go as planned, even if you're
Mhm.
incredibly prepared. And you obviously are someone who's very well skilled and trained to deal with those things. So, for our patients out there who are looking for a new injector, what are the right questions they should ask before getting injected?
What's your medical background? Um I'm sure that these injectors will become great injectors, but the people coming straight out of nursing school, going straight into injecting and not getting any of that medical background in the hospital, I don't agree with that because of the little things. What do you do if your patient has a syncopal episode and faints in the chair? Do
Right.
you even know how to handle that? Do you know to like lay them back, stick an ice pack on their chest? Those are simple
Yeah.
things, but also, when you have it in a controlled setting like the hospital and you know you have people around to help you, you're not going to freak out. But if you're a new injector and this is happening, you're probably going to freak out and more can happen to that patient.
Right. So what credentials actually matter? What do you think? I mean, you've kind of done both worlds. Tell me your thoughts on that.
I think that nurses are perfectly capable, but they need to do the extra studying and learning and training about autoimmune disorders and, all of the things that can go wrong potentially with what we're injecting into our patients. I went back to NP school because I felt like I just didn't know enough about the pathophysiology of our body. And I was kind of just injecting blindly, so to speak, with not knowing enough. In my mind, I didn't know enough, but I always feel that way. I'm always like yearning to learn more and more and gain more knowledge. I want to know it all. So I think that they're capable. I think it's based off the person, right? How
Yeah.
eager are you to learn? And continue to learn because this field is ever changing and things are happening. I think experience is important too. You learn from your mistakes, you start to get a feel for what tissues feel like, what planes feel like. You get that eye and you develop that aesthetic eye more and more the more that you're injecting. So I think it is person dependent and experience dependent. It took me a while to feel confident as an injector.
And you're a damn good injector. She's injected my whole face. So I am a Dani product and I get so many compliments. Thank you. I love it. Love it. I'm gonna have to fly to Boston to get my next injections.
Come on down.
But so here's the other thing. There's a big price range in aesthetics depending on where you go. I get this a lot from people, trying to bargain down to the lowest price. Why do you pay
Hmm.
more for experience and expertise? I could go on and on about this, but
Yeah.
I'll let you start and I'll tag in.
I mean, the easy answer is we get it done right the first time, right? Like,
Right.
you can go to somebody who is cheaper, who drops your brow because they don't understand the anatomy of neurotoxin, or makes your cheeks puffy, or distorts your animation because they're in the wrong layer. Like, we get it done right first, and that doesn't come without cost. It's expensive to continue education and continue learning and training and all of that. So we're trying to get that money back too, on top of the money that is spent for product and, for med spa, the money that you're spending to pay your injector and
Right.
continue their education, all of that.
Yeah. So true. Yeah, no, and if people want to pay less, I tell them go for it. We'll see you when you have to come back and we have to fix
Literally,
it.
I feel like 90% of patients have come back to me and been like, yeah, I didn't like that injector. And I'm like, told you so.
Right. What are some red flags that patients should watch out for if they're going to a new injector or a new med spa?
Factory. If you don't get the personalized treatment, the time to get to know you, I have to get to know my patients, because my patient that comes decked out in Chanel is going to want a different aesthetic outcome than the mom who's got her messy bun up and, is in her Lulu clothes just coming from the gym. I want
Yeah.
to get to know you as a person too. So that's
Right.
my biggest red flag, is if they just take you in and they're just doing the same thing to everybody, that's not personalized, it's not genuine, and it's just not going to be a good result for you.
Yeah. What about and we've both seen this quite a bit. What about the patients that come to you who've had a lot of treatment and want more, but it's probably not the best idea?
Mhm.
What do you do when you run into that?
Well, I first try to focus on skin health treatments, because we all can use skin health treatments, and that's including like daily skincare. What are you using every day? Microneedling, lasers. I think brightening the face is great. If someone is overfilled and they want more and they keep wanting more and they're not listening to me, I just say, I don't think I'm the right injector for you. I don't think my aesthetic eye lines up with what you're wanting from me.
You're
And
so
that's it.
nice and diplomatic. You
You
don't
have
tell
to
them they have
be.
body dysmorphic disorder.
Even if I did, they're just going to go on to the next. And that's the other red flag, right? Is the
Right, right,
injector that never says no to you. Like, that
right.
is probably even bigger than what I said before.
Yeah, yeah. No, that is true. That will inject no matter what. I think having that ethical restraint is really critical as well, which you do a great job with.
Yeah.
So one of your specialties is regenerative medicine and
Hmm.
creating natural results. What does that mean to you
That
in
means
aesthetics?
I want your body to do some of the work. So we start losing our collagen depending on what article you read or who you talk to, age 21 to 25, 1 to 3% a year. So by 45, you've lost about 25% of your collagen production. And that's your framework and of laxity, wrinkles, fine lines, texture, tone, glow. So I utilize Sculptra because that's a biostimulant and it stimulates collagen within. I utilize laser because it's doing the same thing. We're all chasing collagen. So that's why that's where I go for my treatments. I do filler, but I want to get your skin health but at the best it could be before we do the filler.
Explain to our audience who may not know the difference between Sculptra and Radiesse, which are biostimulants versus
Yeah.
fillers, because there's been a big shift in the industry in the last few years
Mhm.
towards more of those biostimulants. And I think it's
Yep.
a little bit of a nuanced conversation for people who aren't in the field. And so if you can break it down simply.
Absolutely. So Sculptra is polylactic acid. Polylactic acid is in the dissolvable sutures that they use in the OR. So what it's doing, you mix it with sterile water, you inject it kind of like a filler, and it causes a response to your body, a controlled inflammatory response to break down those particles and stimulate collagen. So I use my Sculptra as more of like the icing on the cake. I like it in my dermal layer. I like it for skin tightening, skin thickening, and just overall a natural, beautiful glow. And then Radiesse is a filler, but it's calcium based. So it kind of does something similar where it's reactive in the tissues. So it irritates the tissues around it. That irritation, because you essentially cannot stimulate collagen without causing some sort of trauma to the tissues. I tell my patients all the time, like the cauliflower ear that boxers get or MMA fighters get, that's all collagen. Like, look at their faces. Look at boxers' faces. They have great skin because they get beat up all the time. And that's essentially what we're doing, right? But it's a controlled
That's a
process,
great analogy.
right? If you
Yeah.
start looking at them, you're going to be like, wait a minute. Radiesse will give me my volume back. So I love Radiesse in like the lateral cheeks. I love it in the jawline. It gives me volume while stimulating collagen, whereas Sculptra is strictly just a biostimulant.
Okay, got it. So, how do you approach natural looking results so patients never look overdone? Because
Yeah.
you're really well at that.
It's multiple modalities, right? I love to start with skin health. If I could get every single patient coming to me to do radiofrequency microneedling or laser first, I would do that. But not everybody is prepared for the downtime that comes with that. But it's also a holistic approach. So we don't age just in our cheeks or just in our jawline. We age all over the face. So I start from top to bottom, lateral to medial with my approach. I think everyone could use sculpture in their temples. Everyone. The temples are almost like a forgotten area that does so much for the entire face. So I love to start in the temples and then just go down from there and see what they need.
Yeah. Um, aging really is a privilege, and but when we can age
Mhm.
intelligently, structurally, and
Mhm.
in alignment with our biology, we're winning that game.
Right.
Let's switch over to functional medicine as it relates to aesthetics.
Love it. Yes.
So, how do you tie in functional health into aesthetic outcomes?
Well, when you look better, you feel like you look better. You want to take care of your body more and you want to feel better. So, when I'm sitting there talking to my patients and they're like, I'm so tired. I slept like crap last night. I'm like, okay, how old are you? When are you still getting your period? Do you have any perimenopause symptoms? Like, let's talk about those things. And people start to feel so much better after like bioidentical hormone replacement therapy, microdosing the GLP-1s for inflammation more so than like weight loss. I don't know how I feel about NAD still. I think it is a great tool, but at the same time, I want to do more research on it.
Yeah.
But I think if we're replacing what we're losing with time, our hormones, our testosterone, our estrogen, women hear testosterone and they think they're going to grow a beard and, get back knee. And it's like, no, we need that. That's part of our hormones and we lose it. And that's where our fatigue is coming in. That's where our brain fog is coming in. And as a woman in her 40s now, like I've taken a lot of I want to learn a lot more about hormones and functional medicine and teaching my patients that it's not just about what I can do for you here, but you have to do your homework at home too. Like, you have to be fueling your body correctly. You have to be getting up and moving your body. You have to be prioritizing your sleep and making sure that you're taking care of yourself too.
Yeah, all of that is so incredibly true. I think people don't realize that it is all so tightly connected. Our hormones, inflammation, sleep, stress, all of that impacts every cell of our body, all the way out to our skin. And sometimes that
Mm-hmm.
gets lost on people. So yeah, that's a great point. Injecting them is not going to fix poor internal health. So
Nope.
it has to be outside and in at the same time. What are some myths in aesthetics that frustrate you the most?
That filler makes you puffy, I think. It's all about whose hands the filler is in and the treatment plan that you are creating together, and that, getting neurotoxin or filler makes you look fake. I have all this stuff in my face. I have
Yeah,
Sculptra in my face. I have filler in my
you don't want
face.
to
I have
say how much.
Radiesse.
I'm not going to say how much either.
I mean, look at, I can't even furrow my brow because I have
No, neither can
toxin in
I.
my face. Like, this is how much I can lift. I don't feel like I look fake. And when I tell my patients that I'm 40 years old, they're like, "You're what?" And I'm like, "Yes." But I also take very good care of myself too. I watch my diet. I am exercising every day. I'm doing all that homework at home too. I'm doing my
Yeah,
daily skincare. I'm wearing my sunscreen. I'm doing all of that. So,
yeah, it is key. It's a comprehensive, holistic plan for sure.
mhm. Mhm.
Okay, let me ask you about this myth. True or false? Can someone safely learn to inject in a weekend course?
Hell no. Sorry. Is that allowed to say?
Yeah.
Absolutely not.
But it happens. How often do you see this happen? All the time, right?
All the time. I had so many people reach out to me and say, "Dani, how'd you get into aesthetics? What course did you take? What certification do you have?" I don't have a certification. I found somebody who wanted to take a chance on me and wanted to allow me to grow. And I learned from that and continued to grow. There's no course in aesthetics like med school or
Yeah.
nursing school. No,
Yeah.
absolutely not.
That's an excellent point. So, what do you say to those nurses and people who want to break into aesthetics? Because it's really hard. I have people,
It is really
same
hard.
thing, are coming into me and asking me how to do it, and
My
it's a
hand.
it's tough to get in.
Yeah. I mean, like any, industry, right? It's all in who you know. So you have to kind of get in. I was lucky enough to get into the plastic surgery center. It's very well known. So I could use that name, and they helped me with injecting and gave me a platform to sort of work off of.
Yeah.
So if you can go in with a doctor, give your time. Hey,
Yeah.
Dr. So and so, or, you find an injector. Do you care if I shadow you for the day? I
Yeah.
don't care. Like, I didn't charge people to shadow me because I just didn't feel like I needed to do that. But some people do, and that's okay. They're giving their time and expertise. So kind of doing that and really delving into everything. Another red flag that just popped in my head is the ones that do it on the side. I
On the side
don't,
of
you have
what?
to it's like their side job is
Oh,
aesthetics, their fun job.
okay. Well,
I
that
inject
makes
for
no.
my
I didn't even know what you
yeah,
meant because it seems so absurd.
it is. And that's where it's like, no, you have to do this like full time. You have to see so many people to truly understand the anatomical differences that we have. They're millimeter differences, but they're
Yeah.
differences, and they make a very powerful impact if you're not understanding them.
Yeah, and like you said, it's a numbers game. It takes volume, like a large
Mhm.
volume of people, for you to start understanding and getting a better, and to learn and to grow. I completely
Yeah.
agree. What do you feel is the difference between technical placement versus true medical artistry?
Technical placement is, the 1 centimeter up, 1 centimeter over, and you're totally safe in this area. There's no, a deep temporal artery there or anything else. True artistry is really feeling the tissues you know if you're in something in a patient because you're watching the way your patient's reacting while you're injecting and making sure that every single slight movement that you're doing, you're watching that and you're aspirating and you're feeling for being in the right tissue plane and all of that. So, and it takes a lot of time. I've been doing it for 6 years now, and it's still like a learning experience for me.
Yeah, I have no doubt. Yeah, it does take years and constant learning and kind of not, I don't want to say failing, but like learning from
Yeah.
mistakes and getting back up and trying to figure it out and do it better. And I think that's key too. What is the one thing you wish patients understood before walking into their first appointment with you?
Everything's not gonna be fixed in this one appointment. This is not a sprint,
Yes.
it is a marathon.
Yes.
We need to have a year-long relationship, and if you don't like me after that, break up with me, that's fine. But if you give me a year, I guarantee you'll love me.
It's true. It's true. And to that earlier point, I think people who maybe haven't been doing aesthetics and come in for their first appointment do think that like, okay, I just need one appointment and reverse, 50 years of
Mm-mm.
aging. It just does not work that way. It's so complex and
No.
there's so many layers of treatments like we were saying. So yeah, let's
And it's an investment too, right? You're investing in yourself and it's not cheap. And I try to be mindful of that with my patients while also not cheapening my services and my expertise and what I can do for you. Because we have so many options now. We have,
yeah,
the cherry option where you have a financing option for like
right.
0% and all of that. We have, memberships where you can put money aside monthly so that it builds up so that you have that when you come in. There's a lot of options and you have to be prepared for that
Yeah,
investment too. And it's a forever investment. If you stop the treatments, you're going
yeah,
to age. Like
right.
there's
Right.
just no
Yeah.
going around it.
Yeah, it's a commitment for sure. But, looking good also makes you feel fantastic. So it's not
Hmm.
just, yeah, it has its benefits beyond just the vanity of it.
It does.
Let's do a little rapid fire, a couple of questions, just four of them. What is the most misunderstood injectable?
In the sense of like patients misunderstanding it or providers misunderstanding it.
I'll do both.
I would say patients misunderstand neurotoxin for sure. They come in, they think it's going to work in an hour, and it takes 2 weeks to settle. Asymmetries happen. They want you to fix it immediately. You ask them to wait the 2 weeks. They get frustrated, but you just got to give it that time. I think with injectors, probably filler, and just understanding that it doesn't take 6 syringes to make an impact, that it's more about placement than the amount.
Yeah. Okay. What is the most underrated treatment?
Skin health laser. When your skin is bright and beautiful, you aren't worried about other things as much.
Yeah. I would definitely agree. Having just gotten a CO2,
Hmm.
it's like it makes a huge difference.
I mean, how much you look in the mirror and you're like, oh my gosh, my skin looks so good. And you're not like, oh, my jowls are happening. You're just like, my
Right.
skin, it's bright, it's beautiful. I love it. I don't have to wear
It's
makeup
true.
today.
Yeah, I know. Between you and Morgan, I feel like I'm reverse aging every day.
Yeah.
One non-negotiable for injectors. What's that?
Safety. I mean, you have to put
Yeah.
that first.
Yeah.
You can't just start poking around and not know what is around that. You have to know where your foramens are. You have to know where your arteries are. You have to know all of that. You have to know your anatomy.
Yeah. One piece of advice for patients considering aesthetics.
Invest in yourself. It's okay to. I know it's not the best financially, but when you feel better about yourself, you take care of yourself better. You start eating better. You start doing things that just make you feel better. Just do that for yourself.
Yeah,
Invest.
I love it. I love it. Any final thoughts that you want the world to know?
I mean, aesthetics can be scary, and I get that. I My biggest thing is find an injector who feels like an old friend who you can go in, you can have a conversation with. They understand you. If you need to cry that appointment, you cry a little, they poke you with some needles and then you just feel better because they're understanding what your aesthetic goals are because they really do truly understand you.
Yeah. And care. I think that's so true.
Genuine.
Well, I love your message, Dani. Aesthetics is medicine. Injectables are powerful tools, but they require training, anatomy, expertise, experience. Safety isn't optional. For anyone listening, choosing the right injector is about more than convenience or cost. It's about who you trust with your face, your safety, and your long-term results. So if you found this episode helpful, share it with someone considering aesthetic treatments and help us continue the revolution towards thoughtful, ethical, medicine-first care. Dani, thank you so much for bringing your expertise, your heart, your humor, and your commitment to safety to this conversation. I loved it. And until next time, this is The Kind Revolution.
Thanks for joining The Kind Revolution. If this gave you something real, hope, perspective, or a fresh way to think about health, please share it, subscribe, and pass it on. Medicine won't change on its own, but together we can reimagine it and build something smarter, kinder, and create a system that truly heals. This is The Kind Revolution with Dr. Nanos, where science meets compassion and the future of medicine gets brighter one conversation at a time. Thanks for joining the revolution.